Welcome to the deep dive. Today, we're strapping in, getting ready for a deep dive into the world of SHOCK.
Ooh, shock.
You sent us some seriously compelling research
Yeah.
on what causes shock, how to assess it, and the latest in investigative techniques.
It's definitely not your average doctor's office visit.
Not at all.
That's for sure.
So, to kick things off, let's address the elephant in the room.
Okay.
What exactly is shock? And I don't mean that surprised feeling when you walk into a room and forget why you went in there.
Right.
Although I guess there are some similarities.
Well, that surprise feeling is actually not too far off.
Right.
Shock,
Yeah.
in a medical sense, is when your body experiences a sudden jolt.
Okay.
But instead of your brain forgetting something,
Yeah.
it's your cells screaming for oxygen.
Oxygen, like
What?
the stuff we breathe.
The stuff we breathe, yeah.
That's dramatic.
It is dramatic. The article uses this term, cellular hypoxia.
Okay.
Imagine this. Your cells are throwing this huge party, everyone's invited, the music's pumping, but oxygen, the guest of honor, is stuck in traffic. Right. And without enough oxygen, your cells can't function properly.
Right.
And that's when things get dangerous.
Okay. That's a visual I can get behind.
Right.
My cells sound like they know how to party.
Right.
But seriously, that's a great way to understand cellular hypoxia.
Yeah.
Now, the research you sent mentions different types of shock.
Okay.
What's the deal with that?
Right. It's not a one-size-fits-all situation.
Right.
Think of it like this. There are different ways that oxygen's VIP entrance to the party can get messed up.
Okay. I'm intrigued. Walk me through it.
Okay, so first up, we've got hypovolemic shock.
Hypovolemic shock.
This is where you lose a significant amount of fluid. Think severe bleeding or dehydration.
Right.
It's like someone spilled half the punch bowl before the party even started.
Oh, no.
Less fluid means less blood volume,
Okay.
and less blood volume means less oxygen getting to the party.
Makes sense.
Yeah.
So what about the other party fouls?
Well, then there's cardiogenic shock. And this one's a real heartbreaker, literally.
No.
It's where your heart, the main pump for all that oxygen-rich blood, isn't pumping effectively,
Right.
often due to a heart attack.
Wow.
It's like the party bus broke down on the way to pick up oxygen.
So unlike hypovolemic shock, where the issue is the amount of fluid, here it's the actual pump itself that's causing the problem.
Exactly.
Okay.
Then we have obstructive shock, which is like a massive traffic jam in your circulatory system.
Okay.
Imagine a rogue, bouncy castle blocking the highway. That's kind of like what a blood clot or fluid around the heart does in this case.
Oh, wow.
Blood flow gets obstructed, and oxygen can't reach its destination.
Wow. That's a lot of pressure on those poor cells trying to keep the party going.
You said it.
Yeah.
And finally, we have distributive shock.
Oh.
This time, it's not about a lack of fluid or a broken pump. It's more like the pipes themselves have sprung a leak.
Okay.
This is when your blood vessels dilate too much,
Right.
like in sepsis or anaphylaxis,
Right.
causing a dangerous drop in blood pressure.
Wow.
It's like someone left all the doors to the party venue wide open.
Oh, no.
Things spread out too thin, and oxygen can't get where it needs to go.
So 4 main types of shock, each with its own way of crashing the cellular party.
Exactly.
This is already making my head spin a bit,
Yeah.
but in a good way.
That's what we're here for.
Right.
It's all about understanding the complexities.
Absolutely. Now, for our listener who might be wondering how to spot shock,
Okay.
what are some telltale signs that someone's oxygen party is on the verge of shutting down? What should raise alarm bells beyond the obvious racing heart? So we've got these different types of shock, each with their own way of throwing a wrench in the oxygen supply chain. But how do you know if someone's actually experiencing shock? The research you sent talks about looking for signs of poor blood flow.
Right.
But what does that even look like beyond the obvious, like a racing heart?
That's where things get really interesting. It's like medical detective work.
Ooh, okay.
Beyond a rapid heartbeat,
Yeah.
there's some sneaky clues that can tip you off.
Sneaky clues. I'm all ears.
Well, the research mentions rapid breathing is one.
Okay.
Think about it. If your body senses it's not getting enough oxygen,
Yeah.
it tries to compensate by breathing faster,
Yeah.
almost like it's gasping for air.
Makes sense. It's like trying to suck in more oxygen, even if it's not getting to where it needs to go.
Precisely. And then there's confusion or disorientation.
Yeah.
Remember, the brain is a major oxygen hog.
Right.
So if it's not getting its fill,
Yeah.
things can get foggy up there pretty quickly.
Oh, so that's what people mean when they say someone is in shock and not making any sense.
Exactly. And of course, there's pale skin.
Right.
This is a classic sign that blood flow isn't what it should be.
Okay, that makes sense. Less blood at the surface means a paler complexion.
You got it. And you know how when you press on your fingernail, turns white for a second, then pink again?
Yeah, everyone does that little test when they're bored.
Well, that's called capillary refill time.
Okay.
Basically, how long it takes for the blood to flow back into those tiny vessels in your fingertip.
Right.
And in shock, it can be a subtle but vital clue that something's wrong.
Yeah.
If it takes longer than a couple of seconds for the color to return,
Yeah.
it could be a sign that blood flow is sluggish.
Wow, that's a good one to remember. So it's like piecing together a puzzle: rapid breathing, confusion, pale skin, delayed capillary refill time. All these little hints can point to a bigger problem.
Exactly. And once you suspect shock,
Right.
the research highlights some pretty high-tech ways to confirm the diagnosis and monitor the situation.
High tech, like something out of a sci-fi movie. Beam me up, Scotty. My blood pressure's crashing.
Well, not quite beam me up, Scotty,
Okay.
but we're talking about tools like arterial lines,
Okay.
which are thin tubes inserted into an artery to get continuous and super accurate blood pressure readings.
Okay, that sounds way more accurate than the inflatable cuff.
You bet. And then there's echocardiography,
Right.
which uses sound waves to create pictures of the heart in action. It's like giving your heart a live-action ultrasound, allowing doctors to see how well it's pumping and identify any potential issues.
Well, it's a combination of quick thinking on the part of those medical detectives and some seriously impressive technology.
Absolutely. Early recognition and rapid response are key in treating shock effectively.
Speaking of treatment, the research emphasizes acting fast.
Yeah.
It seems like every minute counts when it comes to rescuing that oxygen party. Tell me more about that.
You're absolutely right. Time is of the essence here.
Okay.
The priority is to restore oxygen to those desperate cells
Okay.
and stabilize the patient's condition.
Makes sense. So how do you do that? What are the first steps?
Well, first and foremost, we're talking supplemental oxygen.
Okay.
This could be anything from a simple oxygen mask
Right.
to, in more severe cases, mechanical ventilation if the patient's breathing is compromised.
Okay, so get that oxygen flowing.
Yes.
But what about the underlying causes of the shock? How do you address those?
That's where things get really tailored. The research emphasizes that treatment needs to be customized to the specific type of shock.
Okay.
But a common intervention, especially in cases of hypovolemic or distributive shock, is intravenous fluids.
Fluids, that makes sense.
Yeah,
Replenishing those lost fluids, right?
exactly.
Yeah.
But it's not just about blindly pumping in fluids.
Okay.
The type and amount need to be carefully calculated based on the cause of the shock.
Right.
And the patient's individual needs too much fluid can actually be harmful.
Ah, so it's a delicate balancing act. What else is in the medical toolkit when it comes to combating shock?
Well, sometimes we need to call in the big guns. Medications like vasopressors.
So what now?
Vasopressors, they're like the bouncers of the circulatory system.
Bouncers, now that's an image.
Right. They work by constricting blood vessels, which helps increase blood pressure and get that oxygen-rich blood flowing to vital organs.
So they're like, all right, everybody back in line. The oxygen's coming through.
Exactly. It's all about restoring balance and giving those hardworking cells the oxygen they need to survive.
This is incredible. It's like a high-stakes medical drama playing out inside the body. But what happens when the usual treatments aren't enough?
That, my friend, is where we enter the territory of refractory shock.
Okay.
And it's a whole other ballgame.
Refractory shock sounds intense, even a little ominous. Let's unpack that. What does that even mean and what can be done? This is the deep dive after all. Refractory shock sounds intense, even a little ominous. Let's unpack that. What does that even mean and what can be done? This is this deep dive after all.
You're right to be wary.
Yeah,
It's definitely not a term you want to hear in a hospital room.
right.
Essentially, refractory shock is when the usual treatments, the oxygen, the fluids, the vasopressors,
Yeah.
aren't cutting it.
Okay.
Imagine those bouncers doing their best, but the party's still spiraling out of control.
Right.
That's refractory shock, a stubborn, relentless opponent.
So what do you do when those first-line defenses aren't holding up? Does the research offer any hope in these dire situations?
It does.
Yeah.
But it's a bit like venturing into uncharted medical territory.
Right.
The research mentions some potential rescue therapies, but many are still being studied, and some come with risks.
Okay, so a bit of a medical mystery still being unraveled.
Yeah.
What are some of these potential therapies being explored?
Well, one avenue that's shown promise in certain cases, particularly with septic shock,
Okay.
is corticosteroids.
Corticosteroids, that's fascinating. I've heard they're like the Swiss Army knife of medicine, used for so many things.
Right.
But how do they work in this context when someone is in refractory shock?
You're right. They are incredibly versatile.
Yeah.
In the case of refractory septic shock, corticosteroids help to modulate the body's immune response,
Okay.
which can go haywire and actually worsen the situation.
So it's like calming down the storm inside the body rather than just trying to bail out the water?
Exactly.
Okay.
But even with corticosteroids,
Yeah.
the research emphasizes that they're not a guaranteed fix,
Right.
more like a tool in the arsenal.
Yeah. And one that needs to be used cautiously.
So what else is there? What about these other potential therapies you mentioned, the ones still being explored?
Well, one that's particularly intriguing is methylene blue.
Methylene blue.
Yeah.
Isn't that the stuff they use to dye things blue?
Right.
What's that got to do with shock?
It sounds strange, right?
Yeah.
But methylene blue also has this interesting effect on blood vessels.
Okay.
It can help restore proper tone, particularly in distributive shock where those blood vessels are dilated too much.
Right.
Remember our open-door party analogy?
Right. It's like someone finally decided to close those doors and get the party back under control.
Exactly.
Okay.
However, the research cautions that methylene blue is not a first-line treatment,
Okay.
and more research is needed to fully understand its benefits and potential risks. So a promising lead, but not a slam dunk. I guess that's how it goes with cutting-edge research, always pushing the boundaries. What about other options?
Another avenue involves a hormone called angiotensin II.
Angiotensin II, that rings a faint bell, but refresh my memory, what's so special about this hormone?
Well, angiotensin II plays a big role in regulating blood pressure.
Ah, blood pressure. That makes sense, given we're talking about shock.
Yeah.
So is the idea to give the body more of this hormone to boost blood pressure?
You got it. And some studies have shown promising results with angiotensin II in treating refractory shock.
Okay.
But again, more research is needed to confirm its effectiveness and determine the best course of treatment.
It seems like a recurring theme in this area of medicine.
Yeah.
Always investigating, always refining those treatment strategies.
Absolutely. The research also touches on intravenous immunoglobulin, or
Oh,
IVVGA for short.
IVVG. Okay, that one sounds vaguely familiar. Break it down for me.
Think of it like a superhero squad of antibodies ready to fight off infections.
Okay.
It's essentially a concentrated dose of antibodies that can help boost the body's immune defenses,
Right.
especially in cases of septic shock caused by certain bacteria.
So like sending in reinforcements when the body's own defenses are overwhelmed.
Precisely. While it's shown promise,
Yeah.
especially in specific situations, the jury's still out on its widespread effectiveness. More research is needed.
It's incredible how much research is going into this one condition.
Yeah.
It really speaks to the complexity and seriousness of shock.
It absolutely does. It's a reminder that shock is not something to be taken lightly.
And that brings us to the most important question. What does all this mean for our listener? What are the key takeaways from our deep dive into the world of shock?
I think the biggest takeaway here is the critical importance of early recognition and intervention.
Right.
We've covered a lot of ground here, from the different types of shock to the cutting-edge treatments being researched.
Right.
But it all boils down to recognizing the signs early and seeking immediate medical attention when needed.
Right.
You never know. It could save a life, maybe even your own.
Knowledge is power, as they say. And speaking of knowledge,
Yes.
we've covered a lot of ground in this deep dive.
We did.
We talked about the different ways shock can disrupt the body's oxygen supply, the detective work involved in recognizing the signs, and even the groundbreaking therapies being developed.
Yeah, we really went there.
It's been fascinating and I think really eye-opening for our listeners to understand just what's going on beneath the surface when someone goes into shock.
It's a whole world in there.
It really is. So thank you for taking us on this deep dive, for sharing your expertise, and for helping us all become more informed and empowered when it comes to our health.
Always a pleasure.
And to our listeners, until next time, happy diving.